In this section, I want to talk a little bit about healing times and tissue healing times. Now, if you just Google tissue healing times, you're going to see that classically we're describing wound management, which means that we have an inflammatory phase that lasts somewhere between 4 and 6 days. We have a proliferation phase where the tissues start to knit up, and then that moves into this maturation phase. And that's really great to have the theoretical model, but it doesn't really tell us about what kind of movement I should be doing after my surgery. So fortunately for you, your surgeon has an excellent protocol already kind of scheduled out. And what they've done is said, okay, certain tissue types have certain healing windows. And you actually are pretty familiar with that. If you know you just turn your ankle and it's just a little bit sore, it'll probably be less sore in about 2 or 3 weeks. If you know you did a hard workout, you're probably going to be sore for upwards of 0 to 3 days. You know that a bad ankle sprain can be 4 to 6 weeks, and that most kids who are casted with really subtle fractures is 4 to 6 weeks. You may also know that a really bad break can take upwards of 12 weeks, or that's the same healing time as what we're trying to see the arthroplast, the components of a total knee replacement or total knee arthroplasty or a total hip. They may take a full 12 weeks to sort of become well bonded to the bone. So the surgeon's saying, hey, don't do anything high impact or crazy for 12 weeks. So what you'll see is that if you Google or do a quick search, you can sort of say, well, hey, I'm having a ligament repaired or a tendon repaired, and it may take this time frame. And once again, that's nice because then you can go back into your protocol and understand, I'm having these functional goals set based on keeping me rate limited while my tissues are knitting up or while my tissues are healing. So your physician is never saying, don't do that. What they're saying is, don't do that at this time because you may likely pull out an incision. No one, or an anchor or a repair on a labrum, or your ACL hasn't fully grown in yet. So for example, with ACL recovery, we often see that at 6 to 8 weeks, people are starting to feel really good. They're getting their control back, swelling is down, pain is well managed. But in that 6 to 8 week time frame, we often see that those grafts can be really, really fragile and that they really haven't had a chance to mature yet. So we really try to protect our athletes during that time. They're starting to feel good, and yet the tissues really haven't had a chance to really knit in or grow in or mature. So keep in mind that what I would recommend is take a look at your surgeon's protocol, understand that there's still well body training and zone 2 training, and certainly loading. The worst thing we can do is just say, don't use it for 12 weeks. But understand that the spirit of the protocol, and you and your rehab specialist should be looking at this time frames and saying, hey, what's appropriate here? Now, in our model on the Ready State, when we're working with injured athletes or athletes after surgery, one of the things, for example, is that we'll put speed last because the forces on the tissues are very high. What I'm saying is that deadlifting early will be much easier than it would be to power clean or add speed or cut or change direction. Remember that mass times acceleration, that acceleration is a squared feature, so that impulse on the tissue is really hard. That, it's not necessarily that you're moving your arm in a biceps repair, it's moving your arm quickly in a biceps repair that might challenge the robustness of the repair on the tissues. Nothing that your physician does is going to set you up to have a fragile tissue. But keep in mind that the decisions that you and your surgeon are making together and the rehab professional making are about protecting the tissues and having graded movement loading, so that you can be sort of maxing out what it is you're supposed to be doing while the tissues are knitting. So remember, there's no such thing as a fast healer. You either heal at the rate of a human being or you're healing slower than that. And it doesn't matter who you are, you can't max out or speed up how long it takes for a bone to heal, for a ligament to mature, or for a tendon to mature after repair. So the key here is to look at that, and what I would even recommend is grab a few other protocols. Just search Achilles repair or shoulder labrum repair, biceps repair, whatever your surgery is, and take a look what other surgeons, what other universities are recommending for guidelines. You'll see that's actually pretty sparse. It's pretty open for interpretation because those interpretive goals are set up for us to be able to say, hey, here's where we're trying to knit and protect. The other thing that I would just recommend and keep in mind is that maturation phase can happen for upwards of 2 full years. So typically with ACL reconstruction, anterior cruciate ligament reconstruction, and knee injuries, we say, man, it's a full year of rehab. It takes that long for the associated vasculature to come back online, for those things to mature, for your brain to really own that thing. And for a more aggressive total knee replacement, total hip replacement, we should be thinking about, hey, 2 years could be the full thing. And don't get me wrong, you could have your full life back, but you may not be at full power. You may have continued to have swelling during this time. We try to remind everyone that, hey, 18 months is when we really get a good glimpse of what's going on. Again, I deadlifted and skied right at 12 weeks. I was back on my mountain bike. I deadlifted at 12 weeks. I was skiing at 12 weeks. I think at 16 weeks, I pulled almost 600 pounds on a deadlift, 575. Keeping in mind that that was a slow movement. I had prepped myself. My tissues were prepared. But my knee did not respond like a normal knee were. It responded like a tissue that was normalizing or in the process of normalizing. Of course, your mileage may vary, but also in mind that management of the tissue is not going to be done when you've been discharged. Your rehab will probably run its course for as long as people take on the physiologic time. And then it's up to you and your coach to continue to find deficits, continue to manage soft tissue restriction, continue to work on your range of motion, continue to remind your brain about what your new setup is, and that can progress for a long time. It may be that you've had a knee surgery and you're healed and discharged, but you're gonna have to continue manage swelling for upwards of 18 months or 2 years, and that's okay, that's normal and typical. So, once again, ask your surgeon, hey, can I see my protocol that you're gonna give my physical therapist? And then Google your time frame, look at what your major tissue you're healing, and begin to sort of understand, that's why I'm being rate limited here. Or this is what my goal is. If my goal is at 12 weeks to be able to hop on one leg, I better start standing on one leg early on if I'm gonna be able to add that speed. I better be able to progress to a single leg squat if the discharge criteria is being able to hop on a single leg after this recovery. So, again, the bottom line is it's useful to understand what the body is capable of, understand that our movement and rehab goals are to prepare the tissues appropriately at the appropriate tissue healing stage, and that after you've been discharged, that continuing normalization of that process can happen upwards of 2 years.